Hello, it is my pleasure to record this presentation for the 4th Philippine Association of Medical Journal Editors Annual Convention. I'm going to talk about COPE resources and how to approach using them. To begin with, a little bit of information about me. I trained as a medical doctor and academic, but then I moved on to publishing about 17 years ago, and I was a medical editor for a series of medical journals. During that time, I gained quite a bit of experience of research integrity to the point that I stopped being an editor and became a specialist in research integrity. Since 1920, I have been an independent research integrity specialist, and I am an independent elected member of the Committee on Publication Ethics. And it is as a representative of COPE that I am recording this presentation for you today. In this presentation, I will be introducing COPE and COPE resources. I will also talk about how to get started with COPE resources with a particular focus on the COPE Ethics Toolkit. Then I will look at the practical application of COPE's resources for medical editors and look at some common research integrity issues, both general and medical. I understand that the audience today might be quite varied. Some of you might not have heard about COPE and some of you might be very familiar with it. So I'll tell you a bit about COPE. COPE is a charitable organisation and it is committed to educating and supporting editors, publishers and those involved in publication ethics. It aims to promote ethical practices in publishing and it fosters professional debate in the wider community. COPE has grown to include journals from a wide range of fields, as well as publishers, and it is now expanding to include institutions as well. There are lots of COPE resources which are available for anyone to access as long as they have access to the website, and you don't need to be a COPE member to use these resources. These resources include the COPE guidelines, the COPE flowcharts, and the cases database, and I'll talk about each of these in turn. For COPE members, there are additional resources. These include the COPE Forum. The COPE Forum is a place where members can bring their cases, their tricky cases, in an anonymised way for discussion with other COPE members to get advice on how to manage these tricky cases. There is also an e-learning course for editors and a COPE audit document, which helps you to review your own practices and processes to find gaps where you may not be adhering to best practice. And the document helps you to identify these areas. And there are also sample letters that you can use to help you get started with managing your own cases of research misconduct. I'm going to focus for this talk on the resources that are available for all. As I said, there are many guidance documents available, and it can be overwhelming and unclear to know where to start. My recommendation is that you start with the Ethics Toolkit for a successful editorial office, which is right at the top of the list there. It's a large document that covers what you need to do to qualify for COPE membership, but it also gives advice on how to devise and revise your own codes, policies and processes. This document links out to other relevant COPE guidance to help you to do this and help you to identify areas in need of development. I will pick out some key points from this guide. There are 4 key areas of activity that this guide covers. It covers developing guidelines for authors, developing guidelines for reviewers, developing processes to help you identify ethical concerns, and developing guidelines for responding promptly to suspected breaches of ethics. So as it's such a large and detailed document, I'm just picking up some very key important points from the document. The document covers the need for a clear definition of authorship and the need for you to state the responsibilities of authors and particularly the corresponding author, and also to explain how potential authorship disputes are managed. In addition to guidelines for reviewers, there are also some key points for, in addition to guidelines for authors, there are also some key points for reviewers, such as knowing the ethics of peer reviewing, what reviewers should do if they suspect research or publication misconduct. And then in the policies and processes section, the key points are having processes in place to respond to allegations of misconduct, which can come from various sources, having processes in place to deal with appeals and to screen for common research integrity issues. Your journals should cover a wide range of policies, but some examples of important ones here are having policies on competing interests for authors, reviewers, and editors, having policy on research ethics, particularly when you're dealing with clinical research, and remembering to have policies on legal issues as well, such as intellectual property and copyright. So these are just some points from that ethics toolkit document, and I recommend you do read that when you have the time, because it will give you a lot of details about how to set the foundations for your journal to help you manage research integrity issues when they occur. Now, the next set of resources are the COPE flowcharts. Many have been developed. Sorry, I'll just start the video. Many have been developed over the years to address common issues that come up for editors. They cover a wide variety of topics, and you will see that they have been translated into different languages as well to make them widely accessible. So at this point, I'm just going to pause a bit and just put a question to the audience. Overall, what do you think is the most common research integrity issue handled by journal editors on a day-to-day basis? Do you think it's data fabrication, plagiarism, undeclared conflicts of interest, or authorship disputes? You can pause the video if you like to consider these questions. Well, the answer is plagiarism. Plagiarism is extremely common as an issue, and it affects all fields and specialties, not just medical journals. And the other very common issue is authorship disputes. So moving on to a scenario. So here's a case, a very common occurrence. A reader writes to you stating that the content of an article published in your journal has been plagiarized from their previously published work. You respond to the reader that you will investigate. What is your next step in the management of such an issue? Do you A, tell the authors of the article about the allegation and ask them to respond? Do you B, publish an expression of concern on the article stating that there is an issue under investigation? Or C, do you look out for evidence of the reader's allegation via manual checks and plagiarism detection software? Well, there was a COPE flowchart on this very topic, and that recommends that you look for evidence of the reader's allegations via manual checks and plagiarism detection software. And here is that COPE flowchart for plagiarism in a published article. As we have already said, you would acknowledge the allegation, but then seek to verify it for yourself. This is usually how most flowcharts begin. Allegations are made, and then some are genuine and some are not. So you should always do some investigating yourself to decide whether there is a case to answer. And you'll see that the flowchart then guides you through what to do depending on your assessment of the extent of the plagiarism and the explanation provided by the authors. And this might even involve you retracting the article or referring the case to the people responsible for governance of the researchers involved. Here is another scenario. After the publication of an article, a reader approaches the editor claiming that they should have been an author on the article. What should the editor do? Should they A, contact the authors of the published article, tell them there is a claim to authorship of their article, and offer to mediate a resolution? Should they B, clarify the reason for adding the author, or C, should they do nothing because it's too late to do anything after an article has been published? So again, there's a COPE flowchart on this. And the answer here is the first thing to do is clarify the reason for adding the author. And here is the COPE flowchart for the addition of an author. There you go. The first step is clarify the reason. but it's important that your journal already has established guidelines on the appropriate criteria for authorship. And you remember we mentioned this earlier when we were talking about the ethics toolkit. I'll just start the video here so you can see the whole flow chart. The flowchart goes on to guide you on what to do depending on whether the authors all agree to the addition of a new author or not. You would not publish a correction or change the authorship without the agreement of all authors. And if all authors won't agree, you may need to refer the case back to the author's institution to arbitrate. So here is another case. In this case, an editor of a medical journal, you receive a complaint that there is no statement of ethics approval in an article published in your journal. You look at the article and you agree with the complaint that it's valid. So what should you do? Should you A, immediately retract the article? Should you B, ask the authors for evidence of ethics committee approval for their study? Or should you C, publish a correction to the article stating that the ethics statement is missing? Well, here the answer is you ask the authors for evidence of ethics committee approval for their study. And you remember earlier I said that you should always check the validity of the allegation. And by asking the authors, that's exactly what you're doing. So here is the flowchart for ethics concerns, such as the absence of IRB approval or consent. And again, I'll just show you the whole flowchart. Ethics issues for clinical studies can be complicated and nuanced. And it might be that you need to submit a case to the COPE forum to get opinions from other editors. And here you can see that you might even need to refer the case to the author's institution or other authorities. So that was a quick overview of how COPE flowcharts work. Now moving on to the COPE cases database. You'll remember I told you that the COPE members are able to take part in the COPE forum discussions, and they can bring tricky cases in an anonymized way to discuss and seek advice from fellow editors and publishers. These cases are then written up with the details anonymized and posted on the COPE website in the cases database. So if you have a tricky case and there isn't a flowchart available that fits your scenario, it's worth searching the cases database to see if another editor has encountered a similar problem. And here you see I'm showing here how I'm searched for the word consent to see whether anyone else has ever presented a consent issue at the cases database, at the cases forum before. And you can see that there are lots of cases here where editors have had issues with consent and the cases have been written up. So you can look and see whether there is a case here that was previously presented that is similar to yours. And it might help you to make a decision about what to do about your own case. Here is an example of what a case from a cases database looks like. It's very wordy, I know. I don't expect you to read through the whole thing. I'm going to just highlight the relevant points as we go through this case. So this was brought to the COPE forum by a member of COPE, written up in an anonymized way, discussed in the forum, and this has been written up and posted in the COPE cases database. So in this case, a publisher received a submission to one of their journals, and the concerns were raised about the potential harm or undue risk for participants who took part in the study who may be vulnerable. Now, the publisher reviewed the ethics statement and thought that the authors had actually met the journal policy requirements because they had prospectively obtained ethics approval appropriately. However, the publisher still felt that the paper constituted unethical research, especially because the participants were vulnerable. And they rejected the paper because they felt it was unethical. However, they felt it was important to follow up on the concerns regarding the institutional ethics board because it had, after all, approved the study. So they brought their questions to the COPE forum. And what they asked the COPE forum is is contacting the institution or institutional review board directly an appropriate action? Is contacting the institutional or institutional review board actually too soft an option, and should they be going higher up and escalating the issue to a higher body? And because in this case the institutional review board is not the same, not in the same country as the journal, they were also asking, is there an international ethics approval body that holds all ethics committees accountable? So this was discussed in the forum, and so generally the outcome of the discussion was provided in this advice. So the forum asked if the auditor had contacted more senior people in the institution. So the forum agreed that it was appropriate to go to the institution. And the forum agreed that it was appropriate to seek out a higher body, such as the Ministry of Health or Office of Research Integrity. It also suggested contacting the funding body, because if a funding body is funding a piece of research, they would obviously care if that research wasn't conducted in an ethical manner. And then, of course, the forum warned also that sometimes the journal needs to weigh up the possible risks to the author if they are reported to their institutions or higher authority, because sometimes authors might suffer quite severe consequences if they are deemed to have not followed appropriate policy and guidelines. In this particular case, it wasn't the authors who were being blamed for doing anything wrong. They had followed journal policy. The issue here was more with the institution's ethics committee for approving the study. This case is ongoing, so we don't know what's happened yet. Here's an example of another case. In this case, a paper reported a questionnaire of a study of patients, but it made no mention of ethics committee approval. And the authors were asked to clarify, and they admitted that they had not obtained approval for their study, but they had spoken to the chairman of the hospital ethics committee, who had said that they would consider giving the study retrospective approval. However, on a subsequent communication with the chairman of the ethics committee, the journal expressed doubt about the value of retrospective approval, pointing out, and then the chairman of the ethics committee pointed out that it certainly was not a foregone conclusion that they would have passed the study. So that in the end, there was a unanimous decision deciding that retrospective ethics approval was not acceptable, and the paper must be rejected. So the questions here put to the forum were, the editor was advised to inform again the head of the institution that the study had gone ahead without ethics committee approval. So that was the concern, that even though the journal had just rejected the paper, there were still issues that needed to be addressed in that how was the study allowed to happen without any ethics approval. In the end, the paper was rejected and the editor did inform the head of institution, confirmed. We don't know what happened after that. And then here we have another case. In this case, an article describes 3 similar cases submitted to a journal, and the author was asked to provide evidence of the patient's consent for the details in the paper. 2 of the patients had since died, and the editor explained the importance of consent, and that she would be happy to accept a signed letter from the author confirming that consent had been obtained for publication in all 3 cases. However, the author had obtained permission from the living patient and also from the relatives of one of the patients who had died. And the issue here was whether there was adequate consent. So the advice here was that legally permission is required from living people unless they're under 16 or incapacitated, and that surprisingly relatives have no place in giving permission on behalf of deceased patients. So the explanation provided from the authors was, however, deemed acceptable, as it was agreed that they had gone as far as possible and had acted courteously and with sensitivity towards the relatives. So no further action was required. And here we have the final case that I'm going to show you today. It's about the safety and feasibility of treating patients with acute stroke. It involved an invasive procedure that would cause the patients considerable discomfort. The study had obtained local ethics committee approval, but the editor was worried about the level of consent. The authors were therefore contacted to respond to the editor's concerns. And it's worth noting here that the editor also felt that the study's findings were negative and did not include sufficient, or was not of sufficient power. And so, in fact, the study itself wasn't very well designed. The authors responded that they had approval from their local ethics committee and the patients and the relatives, that most of the patients were awake and therefore were able to understand information both orally as well as in writing, that they had all signed consent forms in their local language, and the authors had kept further documentation if needed, and that none of the authors had withdrawn consent during or after the study. And the authors went on to confirm that a national body controls the ethical aspects of clinical trials in the country very rigidly. So the authors were sort of adamant that they'd done everything right and the consent had been obtained appropriately. So the advice given by the COPE Forum was that whatever the ethics committee said is almost irrelevant because the study design was poor and the sample size too small to give any meaningful results, and that the editor should express their concerns to the institution. That is a very quick overview of how COPE can help you get started if you want to address research integrity issues in a systematic way. There are COPE resources that are available to all. I talked about the ethics toolkit in particular as one of the guidelines that you can look at first, and this covers guidance on what you need to do in terms of policies for authors and peer reviewer. It also covered what you need to do in terms of processes for dealing with allegations of misconduct and appeals, and other policies that you should consider having, such as those on data sharing, competing interests, legal issues, and research ethics. We looked at the COPE flowcharts and how they might help you to manage simple, straightforward cases of research integrity. Authorship and plagiarism are extremely common, so we looked at those flowcharts. And we also looked at the flowchart for ethical issues. And then we also finally looked at some cases from the COPE cases database, which is a record of the cases that are brought to the COPE forum. And we looked at ethics cases, and particularly around ethics, obtaining ethics approval and consent. All that remains for me now is to say thank you to the Philippine Association of Medical Journal Editors for inviting me as a representative of COPE to make this presentation.